Hey, what's up? This is Dan with Due North Adventure Consultants. We're going to talk about how to splint a broken arm. My friend Seth over here fell off the crag and we're going to go ahead and take care of him. So here we are at the bottom of the crag and my friend Seth here is laying against the wall. The first thing I want to do is check and make sure everything is safe. So I'm going to look up the crag and make sure there's nothing that's going to fall down on us and make sure that we're in a safe location. The next thing I'm going to do is I'm going to walk up to Seth. I'm going to check his airway, breathing, circulation, and I'm also most importantly going to check the circulation in his hand and his wrist. Hey Seth, what's going on?
I think I broke my arm.
You think you broke your arm? All right, are you able to wiggle your fingers? All right, can you squeeze my finger? Good. I'm gonna check your thumb here and make sure we have a good refill of blood. Awesome. So his airway is open, he's breathing, he's speaking in complete sentences, he doesn't appear to be in a great deal of pain, and he has good pulse, motor, and sensation in his wrist. So what we're gonna do now is we're gonna splint his wrist. So any good climber has a good first aid kit, and part of that first aid kit should include a SAM splint or an aluminum malleable splint, a couple of triangular bandages, and a couple of roller gauzes. This is what we're going to use to immobilize Seth's arm. Okay, so the first thing we're going to do to apply the splint is we're going to measure it on Seth's uninjured arm. So I'm going to take Seth's arm, I'm going to take the SAM splint, I'm going to measure it to the correct length. So I'm going to use the whole splint. The next thing I want to do is I want to fold the splint. This is what gives it its structural stability. I'm going to take the end of the splint and I'm going to roll it over just a little bit. This right here is where Seth's hand is going to go. So what we're going to do now is I'm going to ask Christine to hold this splint underneath Seth's arm. I'm going to slowly replace her hands with this splint. There you go. So she's going to continue holding that there, while I take this roller gauze and I wrap up his wrist. What I don't want to do is, let's say for instance the fracture is here, the break is here, is I don't want to wrap up directly over the fracture because that's going to hurt Seth. Make sure when you're wrapping as well that you keep Seth's fingers or your patient's fingers exposed so you can check pulse, motor, and sensation after you've splinted as well. All right, so now Seth can hold his own arm right here and Christine is good to go. The next thing we're going to do is we're going to take our triangular bandage and we're going to take it out of the package. We're going to take it out. It is in the shape of a triangle, hence the name triangular bandages. We're going to take this angle here and we're going to tie a knot. This knot is going to go in Seth's elbow. So what I'm going to do is I'm going to reach underneath Seth's arm here, wrap that piece around his elbow, take the two longer ends of the triangular bandage, and while Seth lifts his arm up into his chest, I'm going to wrap these around and I'm going to tie a knot in the back. I'm going to ask Seth, is this a comfortable height for you?
Yeah, it feels good.
Okay, now I can finish the knot. Once I've done this, I'm going to check pulse, motor, and sensation again. Seth, can you wiggle your fingers? All right. Squeeze his finger. What finger was that?
Index.
All right, and he has good capillary refill. Seth's arm's now been splinted. Now it's up to Seth if he wants to go to the hospital in an ambulance or if he wants to take his own car.